So benign bone tumors. So first one is osteoma, which is usually located in the skull or the paranasal sinuses associated with Gardner syndrome. Gardner syndrome, if you remember, is an autosomal dominant bowel condition, so familial colorectal polyposis. It's basically a defect in the APC gene. It's autosomal dominant inheritance, and it's got a high rate of osteomas linked with it. Second one would be an osteoid osteoma and an osteoblastoma, and they're osteoblast in origin with a 3:1 male ratio. So osteoid osteoma, they're usually 1.5 centimeters, but no larger than 2 centimeters. And the key part of the history is that you do get night pain, and it's relieved by simple analgesia such as non-steroidal anti-inflammatory drugs. For the most part, any sort of skeletal pain you get at night is a worrying sign, as most of it happens during the day when you're walking around and running around. Anything that's giving you pain at night is usually linked to some abnormal pathology, such as a malignancy or a benign growth, such as these. And then osteoblastoma, which is of the same origin of osteoblast cell origin. These are larger, so 2 to 4 centimeters. They don't seem to cause as much pain, and that's usually because they're located in the vertebral bodies. But once you do get pain with them, it's not alleviated by simple analgesia. Osteochondromas are most common benign, and they're mainly cartilage and bone together. And these are the ones that form a stalk and a pedicle. So there's a small outgrowth near the end of the bone by the growth plate, and it usually affects long bones, and it's slightly higher incidence in men compared to women. And then giant cell tumor or osteoclastoma, the most common around the knee, 70 to 80% found by the knee, and that's obviously either the tibia or the femur, and it gives you large bubbles on X-ray of a large lytic area on the X-ray. They're very unpredictable growth, which means they can cause a lot of local compressive symptoms, and they can be quite painful, osteoclastomas. So the main way they present will be with a decreased range of motion as they grow quite rapidly at times, and the histopathology will show multinucleated giant cells. And then basically surgical removal is advised because of the way it grows, at a high local recurrence rate of up to 50%. And then endochondromas are benign neoplasm of the cartilage. It's got a male and female equal ratio. It's a disease of adulthood, whereas most of the other ones are sort of in teenage years or before skeletal maturity. This is one in your middle age rather, and any bone tends to be affected. But for the purpose of EMQs, it's usually in the hands and the feet is when you get an endochondroma. And finally, aneurysmal bone cysts are believed to be reactive, believed to be AV malformation secondary to either one of the above benign malignancies or trauma, and it causes a spongy appearance on the X-ray, and it's between 10 and 30 years old. It's the second most common cause for spinal benign tumor, and the most common cause in pediatric pelvic benign tumors.